Come in.
Hello.
Hi.
My name is Vivian. I'm going to be your nurse for today, okay?
Okay.
So I go ahead and close the door for privacy. I wash my hands and identify the patient. What is your full name and date of birth, ma'am?
Judy Jones, 6'3", 61.
Okay, awesome, Mrs. Jones. So I'm going to go ahead and be doing a postpartum assessment, also known as bubble her. Now, before I start, do you need to use the restroom?
No, I just did a few minutes ago.
Okay, awesome. So for a postpartum assessment, you want to ask the client if they need to voice so that you don't have to stop in between. Okay, so I'm going to start by taking your vital signs, which will be your blood pressure, your temperature, your pulse, your respiratory, and also I'm going to go ahead and ask for your pain level.
Okay.
So from a pain scale from 0 to 10, what's your pain level?
About a 2.
About a 2? Okay. Is it okay if I continue with the assessment?
Yes. Please.
Yes? Okay. Now I'm going to go ahead and put on my gloves. So I can give you some pain medication though, since you say your pain level was 2, okay? After the assessment is over.
Okay, I think I'm okay.
Okay, perfect then. Alright, so I'm gonna go ahead and you wanna make sure your bed is locked and you wanna raise it to a good level so you don't hurt your back. So I'm just go ahead and raise the bed, ma'am. Alright. And then you wanna go ahead and move this. Alright. So I'm gonna go ahead and I'm gonna go ahead and uncover you for a bit, ma'am. Okay. So then what you will be checking is on the breasts. You want to make sure that they are soft. And within 24 hours, they usually are, so that's normal. And you want to make sure they're filling and they're engorged. Now also for the nipples, you want to check for any cracks or if you want any fissures, because that can actually lead to mastitis. And then also for the breast self-examination, ma'am, do you practice that a lot at home or not really?
Not really.
Not really? So then I do recommend you to go ahead and do it. It's at least you want to try to do it the last day of your menstrual period, 1 week after that. It's recommended, and also in a private place like in the shower will be helpful.
Okay.
And also for bras, I do recommend like a comfortable one. So the ones with the wires, those are not very good for you right now, so just the ones without the wires. And then I want to ask about your breastfeeding. So how is that going?
Breastfeeding's going okay. It took a little while.
Took a little while, but the baby is latching on now?
Yes, he is.
Okay. Now, if you do have any soreness, ma'am, it does help to put some like cabbage leaves. That's actually very helpful. You don't want to put like too much like ice, because sometimes the ice can actually decrease your milk.
Okay.
Alright, so I'm going to go ahead, so that's B for breast, and now you want to go ahead and U for uterus. So I'm going to go ahead and uncover you now, ma'am, to check your belly, your abdomen. Alright, so for the abdomen, you want to go ahead and make sure that it's soft, and you want to go ahead and it's going to have like a Dougie texture, and you want to look at the rectus muscle, and you want to now go ahead and massage the fundus. So you go ahead and have your hand and your other hand like this to help. and the massage, make sure the fundus is nice and firm. And if her fundus is deviated, then that meant that she needed to empty her bladder. Now, if also the client had a C-section, then for the C-section, you would just go ahead and examine, and you would check for any redness, any drainage, foul odor, and that will be like any signs of infection. You just want to check for Rita. So then after you, it's B for bladder. So you don't palpate the bladder, but you go ahead and ask the client about their voiding. So ma'am, were you able to urinate okay?
Yes.
Yes? Okay, perfect. So then so then I will go ahead and also assess for the bowel sounds now. So then for the bowel sounds, you will go ahead and disinfect your stethoscope. So then you will go ahead and listen to the bowel sounds in all 4 quadrants. Okay. And now for your bowel sounds, ma'am, how have your bowel movements? Have you been able to use the restroom and all that?
Not yet.
Not yet. So we do encourage some ambulation, also some increased fluid intake, some nice fruits, and some fiber in the diet, and that would actually help. So we're going to go ahead and help you out with that, okay?
Okay.
And so that was B for bowel sounds. So then after that, it will be L for Lucia. So I'm going to go ahead, ma'am, and now check for the discharge. So I'm going to go ahead and spread your legs a bit. So for the lochia, you want to check, since it's 24 hours postpartum, it will be like a reddish color, and that is called lochia rubra. That's day 1 to 3, and a few small clots are normal. Now days 3 to 10 is like more of a pinkish brownish color, and that is called serosa. And after day 10, it's like a whitish discharge, and that's called alba. Okay, ma'am. So now I'm going to go ahead and turn you on your side. So then you'll be checking the client for the perineum area, and you will check for any edema, any bruising, any discharge, and you will also check for the presence of hemorrhoids. And if you do see hemorrhoids, then you will go ahead and encourage the client for sitz bath or side-lying positions. Also tux pads with hazel, which is like an anesthetic ointment. And you want to check to see if the edges of the epistomy are well approximated. And you want to check for any redness or swelling on the epidural site. Okay, so now I'm going to go ahead. The next one is H. So E was for the epidural site and epistomy. Now H is for home insights, which is for the legs. So for the legs, you want to check, you're checking for DVT. So you would check for any redness, swelling, if she has any pain, and how you could tell also if the opposite leg is 2 centimeters bigger, then that's a sign that she has DVT. Alright, now so the next one is E, which is for emotional status. So you will ask the client about how they're doing. So how was the childbearing process, ma'am?
It was okay.
It was okay. The birth was that your first baby?
That was my first baby.
Oh wow, that must be exciting for you.
Oh, yes.
So you just want to go ahead and just have your attention to the patient, how the client feels. They might not have that support at home, so it's very important. And also to detect if they have any like baby blues or depression, because if they do and you feel like they might need to talk to somebody, you can request like a mental exam or a psychologist to talk to, like a therapist. So then after E, which is for emotional status, you will go for R, which is for ROGAM. So that will be if the mother was negative and the baby was positive, then you will need to go ahead and administer that. And then the other R is for rubella. So you would check the client's chart, and if you need to go ahead and give them immunization, you will go ahead and do that at the time of the discharge and any other immunizations that she might need at that time. So then you will go ahead and ask the client, is there anything else you need from me today, ma'am?
Not right now.
All right, Mrs. Jones. So then here's a call light. If you need anything, don't hesitate to call me.
Okay.
Just making sure your client is safe, the bed is locked, and she's comfortable. So you can go ahead and take off your gloves and you wash your hands and then you document.